I'm a GP. I've been a practicing doctor since '93, so 23 years. And I began to get aware that things were wrong in the NHS when I read some articles in the BMJ around 2000 about private finance initiative. I read them, I was horrified, but not motivated to do very much. And there was some cognitive dissonance. I couldn't quite believe why a government would saddle its own public service with huge debts. But later on, we had the GP contract in 2004, which seemed to be creating a two-tier workforce. And for me, what did it was the downgrading of one local hospital and then the threat to another neighbouring hospital. And at that point, I thought this is going to kill people. Some of my patients were suffering as a result of lack of bed capacity. And at that point, I said, enough's enough, I need to start speaking out. Because I'd felt that the direction of travel and the increasing management within the NHS was toxifying the relationship between doctor and patient and also wasting a lot of money. And from about 3 years ago, Health and Social Care Act, of course, was a big bombshell. And I started to educate myself in terms of what was going on, the financing of the NHS. Does private sector involvement make it more efficient? Where is all the money going? And unfortunately, all the answers that I was coming up with were not favourable. In order for government to sell a policy which they know is not in the public interest, they have to devise a narrative, a cover narrative which sounds plausible and which may persuade people on a superficial analysis. But actually, when analysed, the excuses used by government in terms of the NHS is unsustainable and blaming certain groups of patients like the elderly, like immigrants, like people who are overweight, creates a distraction. And we aren't really looking at what is actually going on. And what is going on is we're turning one of the best performing, most cost-effective systems, which had very little waste before the reform started, into something which is driven by the need for profit extraction and siphoning away as much money as possible from the delivery of care. Now, an honest politician can't give you that story, so they have to devise a plausible alternative narrative, and that's why you have all these scapegoats. The privatisation of the NHS has been a well-planned long-term project, and private finance initiative plays a key part of the destabilisation of the NHS. These loans were taken out when it was much cheaper to borrow, for the government to borrow directly. Instead, they went to the private sector and borrowed at huge expense. The debts were structured in such a way that in the initial years, they weren't so onerous, but they became more onerous as the contracts got older. And they also included very lucrative service agreements, lucrative for the financiers, of course. And what we now have is the hospital network saddled with toxic loans. And we found out in 2009, the outgoing Labour Party introduced something called the unsustainable provider regime, which is the equivalent of a fake insolvency regulations, which allowed the debts of one hospital to be used to shut down another hospital, which we publicly own, and they have no debts on them. So it was a very clever mechanism for shutting down and selling off what we publicly own, and perversely, private finance initiative protects those hospitals that still have those loans. And the next stage of the privatisation will be to persuade us that these private finance initiative debts need to be removed. But what that will do, actually, is to make the hospitals that were bought and built up with these loans available for sale without a mortgage. The STP is short for Sustainability and Transformation Plan. And this is part of the plan that Simon Stevens cooked up in 2014. Simon Stevens is a very interesting chap. He's spent the last 10 years of his career as president of United Health Global. United Health is one of the biggest American private insurers. And what he wants to do is take us to a system akin to the private American insurance system. And what they have are systems known as health maintenance organizations. The other name is another acronym, ACOs, or accountable care organizations. And what they do is allow the profitable parts of the NHS, like routine surgery, to be segregated out and regrouped into new organizations, whereas the expensive stuff like casualty, acute medicine, intensive care, that service provision will be shrunken and got rid of because it's not profitable. So STPs do several things. They restructure the whole NHS. They will dismantle primary care and general practice. They will force practices to merge. They will convert the whole general practice workforce into a salaried service ahead of transfer to the private sector. Another part of the STP plan is integration. Now, integration sounds great, but what they're really after is integrating the budgets prior to handing those over to the private sector, and integrating social care, which is largely privatized and means tested, with the health NHS budget, which is not yet fully privatized. And then you will have contagion, and you will have means testing brought in by the back door. So integration is extremely dangerous, and it needs to be seen for what it is. Generally speaking, the NHS workforce is largely unaware of what's going on. The project to privatize the NHS has been deliberately complex and long-term, so people haven't connected up the dots. In fact, there are very few people who can do the day job and still find the time and energy to try and unravel this complex deception. They rely on the news. And when you hear in the news that these reforms are reported in a very positive way, integration sounds great. Care closer to home sounds great. But the reality is the destruction of the NHS as we know it. So the answer is our profession doesn't understand or appreciate what's going on. And unfortunately, our representative body, the British Medical Association, has done an appalling job in terms of informing people. And it's my opinion that they're largely complicit with the privatization, as has been recently demonstrated with their capitulation over the junior doctors' contract dispute. The way the NHS is structured now, in 2012, the Health and Social Care Act actually, in legal terms, abolished the NHS. And what it did, it set up a quango called NHS England, headed by Simon Stevens now, who comes from the American insurance industry. And he has the day-to-day power to run the NHS. Jeremy Hunt, who gets all the attention, is actually a distraction. He has very little power in the running of the NHS. And what we're seeing happening is Simon Stevens set up as some sort of savior for the NHS, whereas Jeremy Hunt is portrayed as the bad guy. That's a distraction. Simon Stevens has only got one duty and one ambition for the NHS, is to hand it over to his former colleagues in United Health and the American insurance industry. And I've described him as probably the most dangerous public servant in the country. A significant threat to all public services are these international trade treaties. In fact, they have very little to do with trade, because most tariffs, barriers to trade, have been abolished. What they're primarily interested in is public service budgets, okay? And the agreements that are being discussed now will allow open access to corporations to all our public service budgets. The problem with the NHS at the moment is that because it's partly privatized, it is subject to competition law, and it comes into the grasp of these corporations. Unless the NHS is fully renationalized, it remains under constant threat by these trade deals which are being negotiated. So, you know, if anybody talks about trade, they need to think of public service budget attack. That's what's going on. One thing that I value most within the NHS is my relationship with the patient was not dependent on financial incentives. But over the years, that has changed. And now we're finding more and more that we are being asked to do things that are against our patients' interests. I'll give you one example, dementia screening. screening for dementia in people who are over 65 is a very poor test. It has lots of false positives, so that means patients are labelled demented when they don't have the condition. And that induces a lot of worry, concern, which over time has proven to be unnecessary. But what we've been asked to do is actually collect data on behalf of the future runners of the NHS, which will be the insurance industry, so they can set premiums accordingly. Another thing we've been asked to do is health checks for people over 40. Again, it has no proven benefit to the patients because it tends to attract the already educated and healthy people. It doesn't attract the highest risk people. But what we've done is a massive data gathering exercise, again, for whose benefit? The insurance industry. So I value the relationship I had with my patients. If we go to an insurance system, I will be incentivized to deny patients care. And that's where we are heading if we're not careful. The three elements to the heist. One is the budget, right? So the insurance companies want the budget. The land, property developers want the land. And Google wants the information. And they've already been given 1.4 million patient records in London. And we don't know what they're going to do with it because it's hidden behind commercial confidentiality. There has to be a grassroots, people-led resistance to what's going on. Relying on our politicians is not working. Unfortunately, New Labour did exactly what the privatisation required of it. The coalition have progressed the privatisation further, and now we're entering the home straight. People need to realise that the system we are heading to, the private insurance system, will not only be more expensive, it gives you worse outcomes, and it's endemically fraudulent.